my name is Ella Francis, and I like to present my homeless adult health concerns. So, the population that I chose is a homeless adult population, and homeless adults are people who lack housing. And this homelessness affects health negatively. Homeless people are exposed to infectious diseases such as pneumonia, tuberculosis, STDs. Also, if they already have existing health problems, then those problems get worse by living on the street or in shelters. And also, they are exposed to physical, sexual, and mental violence. So 63 people in Davis County, Utah experienced homelessness in 2018, and over 2,450 people, Utahns, were homeless in 2018, and 552,830 Americans experienced homelessness on a single night in January 2018. Internationally, about 150 million people are homeless. In Utah's rate of homelessness in 2018 was 9 per 10,000 people, which is lower than the average rate of 17 per 10,000 nationally. And there could be a couple of reasons why Utah's rate is lower. So Operation Rio Grande in 2017 took place, and the state of Utah and the Church of Latter-day Saints worked together to provide supportive housing to reduce homelessness in 2018. So these homeless adults population have many barriers in social determinants of health. So for example, they have economic instability. So this extreme poverty leads not to be able to afford housing, healthcare services, food, and clothing. And a lot of them do not have higher level education. So this low education level leads to limited opportunities for employment. And since they live under dangerous living conditions, and these conditions make them to be exposed to violence and poor environmental conditions. And they generally have barriers to healthcare, and they are socially isolated, but they are under the influence of social networks that engage in risky behaviors, and they face increased likelihood of incarceration. So for physical concerns, major cause of the homelessness is poor health, according to National Healthcare for the Homeless Council. So they already have that physical health concern, and psychosocially they experience depression, alcoholism, and substance use disorders. They can develop or can become worse while experiencing homelessness. And economically, without money, finding stable housing is a challenge. So they have to figure out each night where they're going to be sleeping. So there are a couple of root causes as contributing factors. So again, poor health is a major cause of homelessness. So when people are not able to work because of their health condition, this leads to unemployment. Then that unemployment leads to inability to pay for healthcare treatment. So they cannot get well, they cannot heal to work again. So it becomes a vicious cycle. So this population does not really meet physiological needs of a Maslow's hierarchy of needs. So, I mean, they are breathing, but depending on whether they could find food or sleeping or places to sleep that night, they can meet food and water and sleep and excretion, but it really depends on whether they could find place to eat and sleep each night. And most of Maslow's hierarchy of needs are not met. So poor functioning level is anticipated, and likely health outcomes are exacerbation of existing health conditions and the creation of new health problems. So they are exposed to communicable diseases or infections such as tuberculosis, hepatitis C, and this specific population has a 35% higher than general population to have a hepatitis C, and also HIV, they have a 19% higher than the general population. And what can be done to decrease these communicable diseases? Providing housing along with healthcare are the solution, according to National Healthcare for the Homeless Council. So for the non-communicable diseases or infections that these population are at a higher risk, so diabetes, hypertension, heart attack, depression, and substance use disorders. So for depression and substance use disorders, they are much higher to have these conditions compared to the general population. So to manage these conditions, housing along with healthcare is the solution, because to manage these chronic conditions, a safe place to store medication and a healthy diet are needed, and also being in a difficult situation without resolution inside contributes to behavioral health issues such as depression and substance use disorders. And for self-care and self-harm issues, concerns, depression, alcoholism, substance use disorders, and unhealthy diet. So to manage these conditions, housing with supportive services such as education, income benefits, and employment program and food security are needed. And for violence and exposure to harmful weather, those are risk for harm by or to others. So to manage these conditions, housing with supportive services are needed. Once they have a housing, they have a roof over their head, and they have a safe place to sleep every night, so they don't have to worry about or try to find a place to sleep each night, then they can be protected from violence and also exposure to harmful weather. Okay, so that was my presentation for vulnerable population. So thank you so much for watching this video, and here is my references. Thank you.